So my name's Lisa Mangle and I'm the clinical director at ADHD 360 and one of the founders of the company. My role is to oversee the clinicians. I do a lot of the training for new clinicians and interviewing and enrolling people. And I'm also part of the preceptorship of new clinicians. And we need to train our new clinicians on questions like we're discussing tonight, which is all around treatment and side effects of treatment for ADHD. So we talk a lot about treatment, but we don't always talk about the side effects of the treatment and how we manage that. So I'm going to hand over to Karina, who is going to introduce herself and her role. But we do want you to make use of the chat facility because we don't have an agenda. We don't have any PowerPoint slides to show you. We literally are going to work from your chat. So if you've got any questions about your medicine side effects, please write them in the chat, or any questions around side effects of medication, just write it in the chat and we'll be monitoring the chat as we go along. So Karina, introduce yourself and tell me a little bit about your role here at ADHD 360.
So I'm Corrina Matthews and part of my role is the response nurse. So I'm based in the head office and I take calls, clinical calls that come through to the office each day, and I speak to lots of people about side effects and calls, and that's why part of the reason why we put this on here, because I find there's lots of calls with the same questions a lot of the time where we're helping and responding. So it's just some of them same themes, so we thought it'd be really useful to provide this webinar, really, because so many people having very similar questions, really, and some of them were physical side effects and some of them were quite a few themes of anxiety and different things that we found were coming through, so we thought it'd be really useful to come together and put this together.
Yeah. And Rebecca, if you'd like to introduce yourself.
I would. So good evening, everybody. So my name is Rebecca Whelan. I work with ADHD 360. I'm an adult clinician by background, so I assess and treat adults in a clinical role, and also I'm the deputy clinical director, so I work with Lisa in terms of managing the teams of clinicians that we employ, and also responsible for clinical standards, so looking at the overall standard of our treatment and our care for our patients. So that's my role with us.
Brilliant. Just from an IT perspective, Kristin, apparently the chat is disabled, so people are currently commenting in the Q&A, which is fine, but I won't answer your questions there. We're just going to answer the questions from chat if at all possible. So I'll look at your Q&A for now. So not sure what type of questions are okay. So any question is okay, so long as it's around ADHD medication, and I've seen some questions around ADHD medicines and other medicines which we may or may not be able to answer straight away. We might be able to come back to you. Just so that you're aware, we are going to do a frequently asked questions at the end, so if you ask a question that isn't answered today, we can send that out as a frequently asked question. So one of the questions that's come through already is around appetite. So appetite is one of the biggest side effects of stimulant medicines. So Kristin's going to do a poll in a moment around what medicines are you taking, so that we can try and steer the bulk of the questions into the medicines that you're actually taking at the moment. So from an appetite perspective, you know, this is my take on appetite. I think with stimulant medicines, I always say, yes, it is an appetite suppressant. So once you take your medicine, it's likely to affect your appetite. Now, you can easily get round that side effect by always having a good breakfast in the morning. So British people, in my opinion, are really poor at doing that. We usually leave the house with nothing, or we have half a slice of toast, half a bowl of cereal, one or the other, not both. So if you can imagine you're at an all-inclusive hotel, or you're having a 3-course meal, but make that your breakfast before you take your stimulant medication, that's a brilliant idea. So have a bowl of cereal, but then have a slice of toast or a piece of fruit or a yogurt, and make it a proper meal, not just a quick snack. Then at lunchtime, I always say to my patients, set an alarm for lunch, because if you've taken a medicine that might impact on your appetite, then you might not actually feel hungry at lunchtime. Similarly, if it's a child and they're having school dinners or packed lunch, let the school teachers know that they might not actually feel hungry. Some of our patients say it's literally like I've eaten a big Sunday roast and then someone comes along and asks me to eat it again and I just can't. So, don't force food at lunchtime, but then have your main meal in the evening when the medicines have worn off. And if it's a child and you don't think they've eaten enough, then give them supper. So give them some cereal or whatever it is they want to eat at lunchtime. So that's how I manage the appetite suppression. I expect it. So if I'm prescribing a stimulant medicine to someone, I actually expect them to have a problem with their appetite. Rebecca, have you got anything else to add to that? Is there any other snippets of advice that you give that I've not talked about?
No, we're actually keeping an eye on the chat, and some really, really interesting, enough, too much for me to keep up with, really. I'm trying to gather some themes. So there's a couple of things that are coming through about some of the things that you've just discussed in terms of appetite, and trying to work around that, really. So the couple of people that have come through with children that are asking about the advice that you've just given there, that I think you've just explained, to be honest. So it's kind of working around that appetite suppressant effect of medication. Go on, sorry, Lisa.
I was just going to say, I'm going back to my 22 years ago when I started working with children, and I worked with a dietitian because 22 years ago I was really, really worried about appetite in children. And now I've got the tips and tricks to work around it. But the dietitians were giving me really good high calorie foods in small amounts. So I know some children are picky with food, but she said those little Ritz crackers that have got the cheesy stuff inside them, one of those was 75 calories. So they've only got to have 2 or 3 of those and they've had a really decent snack. And then she'd say things like, you forget when kids get older that actually full fat milk is okay. So full fat milk and full fat ice cream with some fruit that they like, chucked into a milkshake, can be 500 calories, and it's the drink. So it's about knowing what calories there are in foods that your kids like, that they don't realize is food. It's just a milkshake when actually it's 500 calories. So I think for children, getting those foods that are in small amounts but high calorie, I think is key.
I think it might be important that we just talk, because there's a couple of things come through about binge eating, and I think because we're on food, I think it's a really good point to make at this point, if that's all right.
No, that's fine.
Yeah, so if we talk, we know that binge eating can be quite commonly associated with ADHD, not for all, but for certainly quite a lot of people, and it is in the criteria when we look at assessing the symptoms. So I think what we have to understand is the balance between. So I often say to my adults that there may be some natural weight loss when we start a medication. That can happen for 2 reasons, really. So one, the side effects of the medication. The medication can make you feel less hungry, and like you've just described, Lisa, we have to try and manage that in the best way that we can when these medications are initiated. Then as a result of your symptoms being treated, you may feel the need to binge eat less. So because of that, your weight is going to decrease, but we would need to assess that on an individual basis, because that's not always a negative effect. It sometimes can be because your levels of dopamine are more steadily released, therefore you're not looking for food for comfort or to stimulate your own dopamine. When that happens, I report that my patients may report to me, and I get a lot of anecdotal sort of responses back that they make healthier choices about what they're going to eat. Their thought processes are slowed down, so they can consider meals, they can plan, prepare, think about organising a meal, and that's really important. So we have appetite loss versus changes in diet. And I think when we're treating people, we have to understand the context of all of that, so that we're not sort of getting really bogged down by the side effects when it may not be. It may be the opposite thing. So I think there were a couple of people that mentioned that. I thought it were worthwhile talking about.
No, and I think what's really important about that, Rebecca, is that, like you've said, some people do binge because of that busy brain thinking about food all the time, and then they're impulsive.
Yeah.
So you make a cup of tea, and by the time you've finished, you've eaten a packet of biscuits, so sometimes patients do lose a lot of weight, but we keep an eye on BMI. So when you wonder why you're an adult and we're still asking you what your height is and we know you've not grown, it's because we're calculating a BMI with your height and your weight. So I think that's a really good point. I think one of the questions I wanted to just take, and it's not specifically about a side effect, but it's like, what are you expecting? What are your results from medication? And I think that's a really good question that is actually linked to side effects. So when we decide to start medicine, so in an adult, for example, I teach our clinicians to look at the difficult times of day. So for me, medicine's not just about work, it's about the waking day, not the working day. So let's see if we can treat as much of your waking day as we can. And my job is to get your medicine as optimized as possible. I want your symptoms to have reduced as much as I can possibly reduce them. However, the side effects need to be tolerable. So there's no point in going up the dose to the maximum dose when actually I can't eat or I can't sleep or my pulse is too high. So we're looking at those side effects all the time, because I want you to be optimized. We know from all the clinical studies that you will have I'm going to steal your statement now, Rebecca, you will have your best life if we get your medicine optimized, if we get that dopamine right in your brain. But we're balancing that up with the side effect profile that we know these medicines have. So it's a really, really good question. And sometimes we have to go with suboptimal response, a response that's not quite optimized and not quite as good as it could be, but you can tolerate the side effect profile that we know can be tricky. And in fact, the question before was around, I've had to come off Elvans because my heart rate was too high. Now, when your heart rate's too high, your body thinks that it's in fight-flight mode. When you're being attacked by someone, your heart rate goes up, your blood pressure goes up, and it kicks out adrenaline so that you can fight whoever it is that's attacking you. So when your heart rate goes up, which is a side effect of stimulants, your body, your automatic responses, right, adrenaline goes up. You're not thinking about it, it's your body just doing it automatically. And when your adrenaline goes up, your heart rate goes up even more. And then you start to feel anxious. So people who are anxious as a side effect of medicine, that's why. Now, I'm not going to go too technical on you, but Elvans, which is in the dexamphetamine group, that keeps the dopamine in the right bit of the brain, but it also encourages more dopamine to be produced. Now, some people have got enough dopamine, it just goes wandering around the brain and doesn't stay where it needs to be. So you're probably a person who has enough dopamine. You've been put on Elvans because your clinician thinks the time of day and how long it lasts is probably the right medicine for you. But it's kicking out dopamine that your body doesn't need. And we don't know as clinicians whether you're someone who has enough dopamine, it just needs to stay in the right place, or you don't have enough dopamine. So we go with the difficult times of day be prepared to switch, which is what your clinician's done. So
Yeah.
your heart rate's gone up with one stimulant, but it doesn't mean it's going to go up with the next stimulant. So that's why they've done that.
Yeah.
So you might be worried that, oh, it's a stimulant, it's going to do the same thing. It might not. And we'll keep an eye on that. We'll keep an eye on that.
Lisa, while you're talking about anxiety, there's a bit of a question, because anxiety does come through, asking if they can take anti-anxiety meds as well. So I don't know if you want to comment on that.
That's a really, really good question. So you can, so if anxiety becomes, you can get ADHD, anxiety and low mood as standalone conditions in their own right. If you develop anxiety as part of a side effect of treatment, but in actual fact, the treatment's working really well, and I don't actually want to stop this, you could do. I'd probably switch your medicine first and see. But if you ended up having to go back to that medicine group, you can actually treat the anxiety. Now, there is a risk of something called serotonin syndrome. Now, it's really rare, and I've only seen it once in 20 years. I'm not sure about you, Rebecca, but it can be really dangerous. You know, you can die from serotonin syndrome. So we don't do it lightly, but what we do is look for serotonin syndrome. So if you needed to go on an SSRI for anxiety, then, and you were also on a medicine for ADHD, I'd want you to do your blood pressure and pulse daily, just to keep an eye on that, because they would go up significantly if you develop serotonin syndrome. And we send you a list of, these are the things to look out for serotonin syndrome. So you can go on medicines for anxiety. There's also a medicine called propranolol that sometimes your GP can prescribe. And I often write to GPs and say, look, we've optimized the ADHD. We are a little bit anxious, but we want to keep taking, you know, my patient wants to keep taking the meds for ADHD. Are you happy to treat the anxiety? And we work in partnership then with the GP.
Yeah, lots of questions coming through about SSRIs, propranolol, anxiety, and I think my experience as well is exactly that, Lisa. So we can have anxiety running alongside ADHD. It can be because of untreated symptoms. You know, inevitably what you'll find is people will go to the GP and the ADHD symptoms are not sort of recognised, and they will be put on an SSRI. So whether that's indicated clinically or whether it's effective, we can sort of figure that out over time. I think the serotonin syndrome is really important to consider. I'm going to agree with you. I've worked in psychiatry for 19 years, and I have seen a true case once. So that's how rare it is, and not with this combination of medication. So it doesn't prevent treatment. An SSRI doesn't prevent treatment with a stimulant. It's a consideration that we would give you advice about, but it doesn't prevent us from treating you proactively for your symptoms. Absolutely not.
No.
Yeah. So we've got, oh, go on. Sorry, Lisa.
No, I was just looking at, we've had a question about atomoxetine. So someone's son's on atomoxetine, are there any long-term side effects? Now, atomoxetine's been around for 20 years. So it's been highly studied in children and in adults. I don't know of any long-term issues with atomoxetine. There are some concerning side effects that we look out for. So, for example, it can impact the liver. It has been known to impact the liver. It's a rare side effect, but obviously we look out for that. But what they had found in the clinical trials was that if they stopped the medicine, if they stopped the atomoxetine, the liver resolved. And in some patients, they did what they call a re-challenge. So they restarted the atomoxetine and the liver became problematic again. So they know for certain that was a side effect of atomoxetine. But they also know that when you stop the atomoxetine, the liver recovers and is back to normal. So that is obviously a concerning side effect, but we know that it resolves. And once the atomoxetine has been stopped, if it's stopped, after several weeks it's out of your system and it's gone. And I actually don't know of any long-term side effects, and I've been using atomoxetine for over 20 years. So you know, I wouldn't have any big concerns about that. But it's a really good question.
Just
really
on that, it's really good. Somebody's just asked how you'd know, and you'd get abdominal pain,
and you'd go yellow.
Yeah. So before going yellow, you'd get pain.
Yeah,
so pain would be the first in abdominal area that can't be explained by.
And you can get abdominal pain with a lot of these medicines anyway, but we're talking significant pain, not just I've got a little bit of tummy ache.
Yeah. Okay.
So next question. I always feel sick in the morning. Oh, that's a good question. I always feel sick in the morning. Now, that's a really good question. So when I say have a good breakfast before you have your medicine, you know, stimulant medicines takes a good 40 minutes to start working. So I always say, and for my patients who are on this webinar, you can hear me saying it, have a good breakfast, 3-course meal, as if you're at an all-inclusive hotel, then have your medication. You don't have to do that. You could have your medicine first and eat half an hour later, but you've got to promise me you're going to eat. Now, as an adult, I know I can have a chocolate bar when I'm not hungry because I do it all the time. So you can have your medicine first if you're an adult, and then have a bit of a break and then have your food. But you've got to promise to have your food. Now, children are different. Children, if they're not hungry, they don't eat. So I think you need to be really careful with children. I like them to have the breakfast first, then medicine, because they just don't eat when they're not hungry, and maybe I need to start doing that. But so just obviously we're giving you the ideal scenario, and I'm not going to make you have a 3-course breakfast when you feel sick, but do what you normally do. Take your medicine. Don't take your medicine too late, otherwise it'll impact on sleep, which we'll probably be coming on to in a moment. But but promise to eat. You must eat, and these medicines work better if you do eat regularly. The way that they're absorbed is helped by actually having regular meals.
Somebody just asked about, well, actually earlier on, about grapefruit, and it's a question that comes up every now and again. So grapefruit juice, it can affect the absorption of the medication, so it's to be avoided. You're right, about an hour before you take. So it's not to say you can't have it, but if you have it around the time of medication, it can affect absorption. So just to clear that one up.
And that's the same for a lot of medicines with grapefruit. So it's I love grapefruit, but I just don't have it anymore because I know it impacts on so many medications. And they say it about vitamin C with in general, with Elvance in particular. Now, I was involved in the clinical trials of Elvance, and I don't actually see the evidence for that in the clinical trials, but I hear it all the time. So maybe just avoid vitamin C when you're taking your medication. Don't have it with a glass of orange juice. Have it with water instead. And an interesting one's just come up that I'm reading about grinding teeth. So I've not written that down as a side effect, but I do know that when when your brain's overstimulated, you can actually grind your teeth and make unusual movements with your mouth and your tongue. So and sometimes that's because you're on a slightly higher dose than your brain is wanting. So it could be that you need to lower your dose slightly, and if it is getting in the way, then that's a reason to lower your dose slightly. If it's I grind my teeth but I can wear a mouth guard at night and I don't do it in the daytime, then and 50 milligrams works for you, then it's okay to continue with your 50 milligrams, but I don't want you damaging your teeth. So you've got to bear that side effect in mind.
I wonder if it'd be useful if we just talked about, because the side effects, when you listen to the side effects, and I think for anybody, and if I were to start this medication, it sounds quite scary, doesn't it? You know, we're talking about all these real, I think, more complicated side effects. But when we start a medication, when we start these medications, many adults don't get many or any side effects. And I think the key is, and we say it, and I know you use the phrase as well, Lisa, so benefit outweighs risk. And that's what I live by, really. So the benefits of the medication, because you're going to get all, if the medication is effective, you're going to get all the positive effects. That's got to outweigh the side effects. Initial side effects that people experience, and I'm sure these calls come through to Karina, like initial headaches, dry mouth, little bit of an upset stomach. If those things are tolerable and you're getting the positive effects, we advise to persist with them for a few days, 5 days. Yeah. After that period of time, those side effects should nicely reduce. Then we've got this balance right. So either few or little side effects, lots of positive effects. So I think, you know, that initial period where if you're feeling anxious, there's a few questions about feeling anxious about all of these things. You know, the process is to make sure that you're feeling comfortable on the medication as well as having all the positive effects as well.
I think what I find is that, because I take the calls in the office each day, that it is usually people phoning that I've been on the meds a couple of days, and that when we call back in a couple of days or we monitor that, they do tend to ease off. And that goes for anxiety as well, because you're suddenly monitoring your pulse and you're concerned, and it feels a little bit different as the medication's settling in, and you're constantly thinking, how is this affecting me? Is my blood pressure going up? And that also can be just part of the starting of the medication, really.
I think what's interesting about that, Karina, is that there's some guidelines for ADHD called NICE guidelines. So the National Institute for Clinical Excellence in 2018 put some guidelines together with the national experts in ADHD, and Jen Lewis-Neal is one of our senior clinicians, and she was on the committee at the time, and they almost removed the cardiac risk side effects from the guidance in 2018, because what they also found was that treatment can be a protective factor for the blood pressure and the heart. Because if you've been living with ADHD for 20, 30, 50, 60 years, you've had a lot of stress and you've had a lot of episodes of your blood pressure going up and your heart rate going up, and that's not good for your heart or your brain. So they actually found that they weren't too concerned about the blood pressure and pulse. Obviously, we keep an eye on it, and it did stay in the guidelines, so we have to keep an eye on it. But it's reassuring for me to know that they weren't overly concerned about the heart, the blood pressure and the pulse. What they were worried about was heart rhythm problems. So if your heart's not beating in the right way, that was a concern. And that's why we asked that question when we do your assessment about long QT syndrome and Brugada syndrome. So a lot of people worry about the blood pressure and the pulse. If you are a worrier about blood pressure and pulse, just do it every day. Trust me, by day 365, you won't be worrying about it. It'll become the norm. So if you're that kind of person, do it regularly. There's also a lady talking about worrying about starting side effects because the list looks worrying. And I once went to a conference where this global expert put up this list of side effects that looked horrendous, and everybody was like, oh my goodness, I'd never take that medicine. And it was the side effects for paracetamol, and obviously we all take paracetamol, so all medicines have side effects. I don't know one medicine that doesn't have side effects, but the common side effects, so those that, when we say common, it's not just a word we pull out of thin air, it's those that occur in more than 1 in 10 of people who take that medicine. So the common side effects are the ones that we're talking about, the ones that, you know, if you're going to get a side effect, you're more likely to get this one. So we look out for it. We give you the advice about the appetite suppression. We ask you to do what we've talked about. We do your blood pressure and pulse regularly, at least every 3 weeks. If not, we tell you to do it more regularly than that. We talk about sleep. We talk about dry mouth, because that's one of the side effects that is in most of our patients who take stimulants. So we're planning for those side effects. We're talking them through, and we're giving you tips and tricks on how to manage them. So I think if you're worried about medicine, you've got to think about what happens if I don't. So what's my life going to be like if I don't try medicine? Because it's okay to worry about side effects of medicine, but nobody ever thinks about the flip side. You know, what's my life going to be like if I don't take medicine? And you know what? These medicines, especially stimulants, if you try them and you don't like them, well, you just stop. And there's no lasting side effects from giving them a go. You know, we can switch between the two stimulant groups, but once you've stopped taking them, the medicine's out of your system. So it's out of your system each day as you go to bed. By the time you get up in the morning, it's gone. So if you're worrying about side effects, they are short-lived and you can stop. You know, it's not a problem. So I thought I'd just mention that. What's cropping up next for you guys? There's so many questions. I'm losing track.
Yeah, there's something about the poll that I'm trying to keep an eye on. WhatsApp. There's a few people have mentioned there's something about the poll that's not coming through. So I don't know if we're getting the poll through accurately. What people have.
So the side effect poll seems to be on my screen. So I don't know whether it's that one that people are talking about.
There's a question here about twitching, Lisa. I thought that was a
Is that about tics?
yeah, my twitching is really getting worse than ever.
Okay.
If that's a... So
that's probably it's a side effect we've not actually thought about before when we're pre-prepared. But there is so you can have you can have ADHD, but you can also have other things alongside your ADHD. Rarely do you just have ADHD. And one of those can be tics. So years ago, when I started in ADHD, they used to think that the medicines caused the tics, but as time's gone on, they realised that actually the tics were there anyway. But when you take a medicine for ADHD and it allows you to focus, it can allow you to focus on those tics as well. So they can become more pronounced. Now with tics, I always say, do they bother you? Do they bother you? Don't think about the people that are around you. Do they bother you? Are you bullied because of it? And that can be the same for an adult or a child. And is it painful? And if the answer to any of those questions is yes, then we need to do something about it. So that's what I would say to you. You know, does it bother you? Are you being bullied because of it, or is it painful? And there is a medicine, so I'm guessing you're on a stimulant. So if you're not, if you wanted to switch to a non-stimulant, then there is a medicine called Inciniv or guanfacine. Now, it's not licensed in adults. Doesn't mean we can't use it. It's not licensed in adults in this country. It is licensed in adults in Japan. But it actually often helps with tics. It's in the same group as clonidine. You might have heard of clonidine, and sometimes they use clonidine to help with tics. So it might be that if the tics are bothering you or they're painful, it might be worthwhile asking your clinician if you can switch to Inciniv. Now, if you're a private patient with us, the GP may not take over the prescribing because it's not licensed in adults, but they might do. So it's worth asking the question. So speak to your clinician. We can write to your GP and say, look, this is the side effect we're experiencing. We know that this medicine is helpful with tics. Would you engage in shared care if I did titrate up through the doses? So it is worth having that question. So, you know, speak to your clinician.
Yeah, I've had a couple of comments come through about caffeine and medication, and it's gone on to talk about we've got energy drinks, caffeine. So yeah.
So my advice around caffeine. So when I'm doing my assessment, and if we start some medicine, I always say that whilst looking the patient directly in the eye to see what the response is. So I always say you must stop caffeine, all caffeine. So no coffee, no tea, no energy drinks, no caffeinated fizzy drinks, no Lucozade. And the reason for that is that they're stimulants, but they're immediate release stimulants. So the level of stimulant in your blood is doing this. Now, my job is to optimize your ADHD medicine. So my medicine's going into your system, and then you have a caffeine drink and it's all over the place. And because then your stimulant in your system is going up, your heart rate will go up and your blood pressure will go up and you'll feel really anxious. Now, one of my patients just had a cup of tea, and there's just as much caffeine in tea as there is in coffee. And it stopped him sleeping. He just could not sleep. And I said to him when I spoke to him 3 weeks later, so tell me how much caffeine you've had. He went, I only had a cup of tea. I told you not to, you know, so we were having a joke about it. But I do say, so when that horror is in someone's eyes, I do say, once your medicine's stable, and I've got your ADHD medicine stable, and we know where we're at, and I know what's your medicine and your dose, you can introduce an odd caffeinated drink and see what happens. But it is once your medicine's stable. So I'm really mean. I'm really mean. Yeah. But I can't do my job whilst you're introducing extra stimulants. And, you know, you guys drink a lot of stimulants because you're self-medicating before you come to us. So it's a little bit of a habit, really.
Yeah, it's blown up, this one about the caffeine, really. But
right.
It's all right. Yeah, no, it's okay. So there's some people who are saying they weren't told they couldn't have caffeine. So lots of different things are coming through about that. So yeah, advice from us is to avoid, if we accept lots of our patients use different forms of stimulants, that people don't realise actually that that's what they're doing. So I was laughing when I answered the question because I drink a lot of coffee. So it's a running joke with Lisa.
Tell you off.
Yeah, that I get a Starbucks order come to my house, but yeah, off subject. So yeah, our advice is to stop those other stimulants, and there could be energy drinks, the energy drinks that you buy in the shops, caffeine, until we stabilize your treatment. You're going to feel quite jittery if you take the coffee or the stimulant drinks on top of your medication. Yeah.
There was a question about medicines and the cost and side effects, and that's a really difficult one because as clinicians, we don't know what medicines side effects you're going to get. And so we have to go with, as we've been doing your assessment, what are the difficult times of day? You know, is it predominantly school and work? So we might go for a methylphenidate, long-acting methylphenidate, or is it actually, it's all day, every day, I've got work, I've got kids, I've got morning routine. So we might go with something that's longer acting. But if that medicine doesn't work, you're stuck with a load of medicine in your cupboard. Now, if a methylphenidate's not working and you're getting side effects from it, cycling through all the different methylphenidates is probably not a good idea. So switching, if you're getting a side effect, switching to another medicine is probably where you need to go. And unfortunately, once a medicine's been dispensed, they don't take it back again for a variety of reasons. And it's really out of our control. And I know it's really frustrating because our job, you know, on my business card, I used to have ADHD detective because I never knew what medicine was going to work for who. So it's not like you've got tonsillitis, you need penicillin. It really is a detective game. And so you can end up with some medicines that you just can't take because of the side effects, and there's no way around it. I mean, that there genuinely is no way around it. And we do our follow-ups as, if you're in the NHS, you'd probably be on a medicine for a few months on the wrong dose, whereas we want to get people on the right dose as quickly and safely as possible. So sometimes you do end up with some medicines that you've not used because we've said, let's stop. Because we don't want you to get to the end of the packet and say, yeah, I've had 4 months of, you know, side effects. It's a balancing act, really, isn't it? And, you know, it's unfortunate that we end up with medicine that you can't use because of the side effects.
Can we take something on mood, just because there's
go for it.
No, there's just a few that have come through about mood. They're recent and they were earlier as well. It's difficult to keep up with this, so apologies. So the mood, mood can be affected with all the medications. The mood can be affected with all medications. That's not for everybody. With all of these things, these cases are individual. So your clinician is going to work through this with you. Yes, it can contribute to changes in mood, and that can be low mood, irritability. We've got some people saying that there's increased suicidal thoughts. You know, these are very serious unwanted side effects that we wouldn't want you to persist with any medication that was contributing to an increased risk at all. So although they all have the potential, doesn't mean that everyone is going to affect you in the same way. Okay, so we've got stimulants, somebody that may be on Concerta, the mood's affected. We have to seriously look at that in terms of your risk. We're not going to advise that you continue that medication if your risk is increased because of a medication that's trying to improve things for you, because that's not going to be the case. So we would have to look at switching it. And I think, you know, mood can be affected by Elvance, it can be affected by Atomoxetine. There will be, just because you have that side effect with something like Concerta doesn't mean that it's going to be the same with Elvance or a non-stimulant. So it is a case of going through the process with your clinician, being open and honest about the effects on your mood, and then making those decisions and choices to switch over. Yeah, there's a couple of people saying it's affected the mood.
Yeah, that's good question. I'm just looking at some, there was a question here about how long does the medicine stay in your system, because they're getting symptoms such as Stevens-Johnson syndrome. So the stimulants are in and out of your system within the day. So you know that by the next day they've gone. Obviously, it'll take a while for blisters to heal, so they're not going to go overnight. The Atomoxetine takes a while to build up in your system. So it takes a good, I would say, 3 months to get to the right dose. And it takes not 3 months to get out of your system, but 7 weeks to get out of your system. So I'm not sure when you stopped the Atomoxetine, but it's probably going to take a little bit longer for that to be out of your system. And there's a couple of other questions I wanted to address. One was, how do I know the medicine's the right dose? So it's a lady who's on 54 milligrams of Concerta. So the only way you're going to know is to go up, because I'm quite pushy with my patients, because I want you to be optimized. I know that your quality of life will be so much better if you're on the right dose. So I will titrate up to the point that I have to come back down, because I'd rather you experience a few more side effects, but know that this is as good as I can get you, than to hover on 54 milligrams and never know what I could be like on the next dose. So I would say go up to the point that I need to come back down. And someone else mentioned about I'm on the maximum dose of something. You know, it is okay to go above the maximum dose of something, providing it's been carefully monitored. And it could be in a clinical trial, they use certain doses, but there will be what we call outliers. And outliers are those that need less than the minimum dose and slightly more than the maximum dose. So again, providing you know that it's what we call off license, it's okay to slightly go above the licensed dose, providing we're keeping an eye on all the monitoring. And there's another question about the menstrual cycle. So for the guys on the webinar, apologies, but it's a really good question. So in the menstrual cycle, you'll find that the estrogen drop, which is the week before your period, really impacts on ADHD symptoms. So there aren't many people globally that do this, but as a service, the clinicians are trained that actually if a lady has that 1 week where the medicines don't seem to be doing what they usually do, then we have a slightly higher dose of medicine for that week. So you might be, for example, I don't know, on 70 milligrams of Elvance for that 1 week and 50 milligrams for the other 3. And that's okay. And there's a lady, Sarah Binder in Canada, who also talks about this, and I've spoken in America about that. So it's becoming one of the leading things to do for ladies who have that problem. So speak to your clinician about that.
Just had a couple about that thyroid medication as well. So I think it's been asked a couple of times.
As in thyroxine?
Thyroxine, yeah.
Yeah. So it's okay to have thyroxine and ADHD medicine. So hyperthyroidism. So when your thyroid level is too high, that can be what we call a contraindication. So when you've got too much thyroxine in your system, it can put your heart rate up really high. And obviously when you take stimulant medicines, that can put your heart rate up. So having a high thyroxine level, hyperthyroidism, is an issue with ADHD. But if you've got hypothyroidism, where your thyroid level is too low, then actually taking thyroxine alongside ADHD medicine is okay, providing you go for your annual bloods. So we know that your thyroxine level in your blood is okay, because if you're on too high a dose of thyroxine, it's going to tip you into that hyperthyroid position. So you must have your annual bloods with your GP for your thyroid, but it's okay to have the two, providing your thyroid is stable, your thyroxine level is stable.
Yeah, I'm just going to take the point before, and I've got to apologise. It's really difficult, this. I want to make sure we answer everybody's questions.
No.
I don't think we're going to do it, but
I have no idea where we are in this list. I just keep scrolling to find a question we've not answered.
Yeah, it just because it's relevant to the point you made before about stimulants. So can affect menstrual cycle, actually. So not much. It's not in the common list, or it won't be in the research, but it does happen. So menstrual cycles can change in terms of frequency and in terms of how you experience your menstrual cycle. So I've certainly had a few female patients where the cycles that have been predictable and routine have changed when stimulants have been introduced. And that's a bit of a wait and watch, and also benefit versus risk kind of situation, because it sometimes does just settle over a period of time. If you experience any changes in your menstrual cycle, you must discuss that with the clinician. And I have known it, at least. I don't know about you, but I certainly have known it. Yeah.
Sorry, Karina, were you going to say something? You look like you're on mute.
That's a common phrase now.
Okay.
There was just one about advice on emptying Elvan's capsules content into water to avoid the E numbers. I thought that was, and then there's a couple of on alcohol as well.
Yeah. So you can I didn't know there were E numbers in the capsules of Elvan's. That's interesting. So yeah, you can. So you can open up the contents and tip it into water. It's supposed to be odorless, tasteless and colourless. Obviously, I've never tried it. You can put it in food if you want to, but you can just dissolve it in water and just stir it around and just drink it down. It doesn't dissolve, it actually disperses. So if you don't drink it straight away, you'll find it all on the bottom. So stir it round and drink it straight away. With alcohol, that's a really interesting one. So in the package insert leaflet, it will say avoid alcohol. Now, that is purely because they've not introduced alcohol in the clinical trials. So they don't really know what happens when you take alcohol with ADHD medicine. However, alcohol dehydrates you, as does the stimulant medicines. So I always tell my patients to drink in moderation, because you'll get a hangover when you don't expect one. So, have an alcoholic drink, but drink a couple of pints of water in between, because I don't want you to be poorly. And the dry mouth is a really interesting one, because every single patient of mine, adult, complains of a dry mouth, and yet no child has ever moaned about having a dry mouth. So they will get a dry mouth. So if you're a parent of a child with ADHD on stimulants, please make sure they drink loads, because they won't tell you, but they will have a dry mouth. And I always say dry mouth, dry brain, and we don't want a dry brain, because that doesn't work properly and doesn't function.
Comment on that. So I also advise that with alcohol, if people do drink on top of the medication, they're likely to feel the effects of the alcohol quicker and more intense than if they weren't on the medication. So therefore, likely to get drunker quicker. You need to be wary of that. We can't always foresee these things. We are adults, so if we're going to events for a day sessions, we've got something planned, I always advise it's best to avoid your medication on those occasions when you can plan for. If you're having a drink in the evening, you just need to be very mindful that you are probably going to feel the effects of that alcohol more so than not when you're not on the stimulants. Yeah.
It's a question on Gilbert syndrome, which is a liver issue. So it's okay to take atomoxetine with something like Gilbert syndrome. It's a really, really rare side effect. I think I've had it once in 22 years. So it's very rare. So just because you have a liver issue going on doesn't mean the atomoxetine is going to make it worse.
Just clarify the point about hypo and hyperthyroidism.
So hyperthyroidism is when you've got too much thyroxine in your system. So if you've got lots of thyroxine in your system, you lose weight, you can be quite shaky, your thoughts aren't great, and your pulse can go really high. So that is what we call a contraindication. So taking a medicine that can then put your pulse up even further isn't a great idea. So if that is treated, then that's different, but we have to bear that in mind. But if it's hypothyroidism, like your thyroid isn't working properly, like me, I don't produce any thyroxine. I have to take thyroxine every day to keep me going. That's okay. But if you take too much thyroxine, then you're going to tip yourself into having too much thyroxine in your system. So you need to be careful. So have those annual bloods, take the right treatment for your underactive thyroid, and you'll be fine. I'm mindful that we've talked a lot about stimulant side effects. So we haven't really touched on, and there is a question about, I'm not quite sure how it's worded, but can you take Elvance with atomoxetine, I think it was. So you can actually take a stimulant and a non-stimulant at the same time, because the stimulants do one job and the non-stimulants do another. So it's a little bit like if you've got a really bad headache, you might take paracetamol and ibuprofen. They're different molecules, they do different things. So we do sometimes have some patients who might be okay on a stimulant, but actually the mornings are really horrendous and the evenings are really horrendous. Whereas the non-stimulant, when they get going and they take several months, they cover a 24-hour period. So they might not be as effective as the stimulants, but they're giving you enough cover over a 24-hour period to be helpful. And then for the daytime, you might need a stimulant, maybe a lower dose of a stimulant because you've got some background cover. So my experience is people who need both might need a lower dose of a stimulant and plus the non-stimulant, but the non-stimulant is weight related, so you need to have the right dose for your weight. But it is okay. It's not something I do all the time, but if my patient needs it, then yes, you can have. So in terms of side effects for the non-stimulants, we've not really touched on atomoxetine and nausea, because for me, that is the most common side effect with atomoxetine that I would end up stopping the treatment for. So other than that, the side effects for atomoxetine are very similar, I would say, to stimulants, because they can up your blood pressure and pulse and affect your sleep, etc. But the most common side effect that I come across is nausea, and it's often one that they end up stopping the atomoxetine for. I was challenged at one of our training academies once and said, why don't you treat the nausea? Well, I don't treat nausea, that would have to be a GP. So if you think the atomoxetine is working and you have nausea, then going to your GP and treating that might be helpful. The other non-stimulant is Inchinib, or guanfacine, however you call it, licensed in children. We can use it in adults if we wanted to. The main side effect of Inchinib is it lowers your blood pressure and lowers your pulse. So we manage that by increasing your fluids, slightly increasing your salt intake, and try and keep some fluid in your system, which keeps your blood pressure up. It can also cause fatigue, and it can make kids fall asleep in the middle of the day. It's impactful. Doesn't always last, so sticking with it is a good thing. Starting it over the school holidays instead of term time is a good idea. But be mindful if you're an adult and you're driving or using heavy machinery. The other thing that we wanted to mention was with Inchiniv, you have to be using contraception if you're sexually active and a child of a female of childbearing age. So it's something that often gets missed because it's a paediatric medicine, but it is something that you should consider if you've got a girl on Inchiniv or a woman. So please bear that in mind. You need to be safe. And we could come into the end of our time, and I can't believe it's 2 minutes to 8. I've had I love these webinars. We've not done one for a little while, but I think someone's mentioned chocolate, and I think that's about caffeine. So yeah, you're right. Chocolate is a bit of an issue with stimulants, apart from white chocolate. And I'm not a white chocolate fan. But no, it's not chocolate. It's just sugar, isn't it? But anyway, if you want to think you're eating chocolate, you're okay with white chocolate. But someone told me I couldn't eat chocolate, I'd cry.
Yeah, and nicotine is a stimulant. Yeah, so it's the same thing. I think we're going to have to, perhaps there's a lot of questions that we've not answered, but we're going to collate the questions, aren't we, so that we can try and answer.
We'll collate all. I think there's about 1,000, but we will go through them. We'll theme them, and we'll give you answers to the burning questions. And if you think you'd want us to do something like this again, because we've literally only just touched the tip of the iceberg in terms of side effects, let us know. Give us some feedback. Just write us a quick chat or drop us an email, because we've thoroughly enjoyed it, haven't we, guys? I've really enjoyed it, and we always learn something on these webinars. So thank you for joining us. If you think it'd be helpful to have another webinar just about side effects of medicine, let us know, because we've had a great time. Have a lovely evening. It's lovely sunny where I am, so I'm going to go for a walk and chill out. So take care and stay safe.
Okay.
Bye.
Bye.
Bye.